Nurses at Ascension facilities have protested, calling out, quote, unfaithful investments that betray both their patients and the church's own teachings.
Which side are you on? Which side are you on?
Members of National Nurses United, which is the largest union of registered nurses in the country, they have been in the headlines a lot lately. We've talked about them on the show a good bit frequently because they've been busy. They've had a lot of good stuff happening. And their stories give us a window into some of the biggest battles happening in healthcare, in the workplace, and in our democracy. So starting with some good news, as I mentioned earlier in the show, down in Florida, nurses at HCA Fort Walton-Destin Hospital voted to unionize with the National Nurses Organizing Committee, NNU. They say they've been dealing with chronic understaffing and unsafe conditions, and this vote was their way of demanding a seat at the table. At HCA Fort Walton-Destin, nurses have spoken loud and clear. We are ready to stand united for our patients and for each other, according to the union. And that's a really major win in the South, where hospital chains like HCA dominate and workers face huge anti-union pressure. And they have racked up some wins here in the South. We've seen it in Texas, in North Carolina, in New Orleans. So hopefully we'll see it spreading to Tennessee and Georgia and Alabama. Would love to see NNU continue this growth and continue this streak of success in the South. But of course, it's about more than just one hospital. Nurses are speaking out about the broader forces that put profits ahead of patient care. At Ascension Health, one of the largest Catholic hospital systems in the country, NNU is sounding the alarm about billions of dollars invested in fossil fuels, private equity, and luxury real estate. As the union put it, Ascension claims to follow Catholic values, but their investments in fossil fuels and luxury real estate show they are more interested in profits than in people's health. Nurses at Ascension facilities have protested, calling out what they call, quote, unfaithful investments that betray both their patients and the church's own teachings.
Hey, 5 seconds. Just wanted to say that this is only possible because of our donors. If you want to see more of this, then consider donating yourself at tvlr.fm/donate.
And it doesn't stop there. At the national level, nurses are demanding accountability from the federal government. They rallied across the country after a federal watchdog confirmed what frontline caregivers already knew. VA hospitals are dangerously understaffed. Congress has been slashing collective bargaining rights and flirting with privatization. As Irma Westmoreland, a registered nurse and VA nurse leader, put it, quote, we know the billionaires who run healthcare corporations are salivating at the opportunity to funnel taxpayer money away from the VA and into private sector care. Nurses are calling for Congress to restore staffing levels and to recommit to fully funded public care for veterans. And beyond healthcare, NNU has also been raising the alarm about democracy itself. They've spoken out against new Department of Labor rules that weaken workers' rights to organize, against voter suppression schemes in Missouri, and against the spread of health misinformation at the highest levels of government. To the nurses, these aren't separate fights, they're connected. The ability of nurses to advocate for safe staffing, for public health, for their patients, is tied directly to whether workers have strong unions, whether communities have a real say at the ballot box, and whether our public institutions are led by people who actually respect science and democracy. So, if there's one takeaway from all these stories, it's this. Nurses aren't just caregivers at the bedside. They are frontline fighters for justice in our workplaces, our hospitals, and our democracy. Whether it's winning a union election in Florida, exposing corporate greed at a Catholic hospital chain, or defending the VA from privatization, nurses are showing what it looks like to try to put people over profits. And that's why the fight for union power in healthcare and across our economy matters for all of us. So really appreciate all the good work that NNU is doing here recently. It's been exciting to see. Again, would love to see it spread. Appreciate all their advocacy as well. It's always great to see that.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.